What processes or tools or resources have you found to be most useful for increasing communication and collaboration with student care team members? And then, just a reminder for everybody on the webinar, we're really defining that student care team as the student themselves, the parent or guardian, the school staff, the the school nurse and their other healthcare providers.
Yeah, absolutely. I think Dr. Buccino and Karen absolutely touched on some of the great processes and tools already, so I'll mention those as well. But once those children have been identified with chronic health conditions that are enrolled in your care, whether you're, in an admin role or an OST teacher, I think then it falls on creating that parent meeting or adult meeting, depending on who's providing care for the child. And then trying to involve all stakeholders if possible. So if you're able to meet with the school nurse as well, the child's therapist, if it's mental health related, but just making sure that everybody is able to be at the table and having the same discussion, getting everything out. I know this can be really difficult to coordinate schedules with all parties. So if that's not possible, making sure that that child's adult brings with them all of the necessary information. So whatever that action plan is, maybe an ROI so that the child's therapist and you as the OST provider can have those conversations back and forth about what they're working on or any scaffolding that you can do. But having that meeting and then going from there, building, I think it was Karen mentioned a binder. I did that for every child that was in our program that had chronic health conditions. I think that it's really necessary given how the OST field is right now. There's high staff turnover. So just because you relayed information to one staff, they might not be there the following week. So making sure that you have some sort of resource for all of the teachers that will be working with that child that they can go back to, and then also making it portable. So we know school age programs like to do a lot of field trips, especially if it's over the summer. So having some sort of binder or material that gets to follow and accompany that child wherever they go. And then, finding out the family's preferred communication technique. So we live in, the realm of technology. So are they preferring text? Do they prefer a phone call, email? We utilized an app called Brightwheel, which we provided care from birth to age 14. So it's more common in the early childhood, but I know in the schools they use like Class Dojo. So if your OST program has the ability to utilize some sort of communication app, I highly recommend it because the feedback we got from parents was that they loved having that immediate ability to reach out to the OST provider and vice versa. So I think it was Karen mentioned sometimes the child is not able to advocate for themselves. So having that ability as the OST teacher to reach out and say, hey, they're exhibiting signs of being tired or they're lethargic. It might not be a symptom of whatever their chronic health condition. It could be, mom chimes in with a message immediately back. We were out late, we went to the movies. So just having that immediate communication definitely alleviates some of that stress and worry on the family side. So, and then I think it's really important to schedule almost biannual meetings with the families just because things change so quickly. So obviously communicate to them that if anything changes within the meantime to reach out to you. But if you are intentional about planning those twice yearly, maybe before the school year and then before the summer program, if your program offers that, just so that you're all on the same page so that you're not, including an EpiPen in your field trip backpack when actually they've tested out of it and they no longer need it. But, you haven't been relayed that.
Yeah.
So, yeah.
Thank you.
Yeah. Well, I'm just going to jump in and just clarify if people didn't understand, an ROI is a release of information, and usually individual programs have those, but if your OST is housed within the school and you are part of that organization, depending on, the school nurse may be able to transfer information back and forth, or you may need to have separate release of information for the school to talk to the healthcare provider, and then also the OST program to talk to the healthcare provider, and also the OST program to talk to the school. So we want to make sure that we're keeping private things private, but also keeping those lines of communication open are really important.
And I just want to piggyback on what Karen was saying about lines of communication, because I think I know sitting in a pediatric provider's office that those automated phone trees can be very frustrating. And I think that developing relationships, if you can, with a pediatric provider's office and knowing, again, the preferred communication. For instance, with some of the programs that I'm partnering with and school nurses, I will often give my email or at least the back line to the office so that there's a known, facilitated, easier way to keep those channels of communication open.
Dr. Buccino, I really appreciate that. And I think it leads really well into my next question, which is, what are some of the strategies or tips that you would recommend for creating relationships? Like, how can you enhance those warm handoffs? Like, what are some of those tips that you can do to improve collaboration? And Dr. Buccino, if you want to start, and then if anyone else wants to jump in, if you have, in addition to, making sure that someone has your preferred, method of communication as the provider. Do you have other thoughts or tips?
I think that, again, if whatever you have, I mean, I'm taking more from kind of the pediatric provider perspective, but I think that for me, when I think about where are my interests, if I'm interested in music, if I'm interested in sports, encouraging a provider maybe to get involved as a volunteer or something like that, because I think the ways you can develop relationships, and then it's easier to build those partnerships if you're doing things together.
Mm-hmm. Yeah. Karen or Rose, do you want to add anything to that?
I absolutely agree with you, Dr. Buccino. I think it comes down to making sure that we're able to provide that high quality care, and that's built upon relationships. So those OST teachers need to carve out that intentional time with the children to make sure that they are making those deeper connections. What are they interested in? And I know you had touched on earlier that sometimes it can feel very isolating when you have a chronic health condition. So then it's even more important for those OST teachers to foster those relationships and create that. And then it's going to piggyback the parents. Once they see that you have a great relationship with their child, they're going to feel more open and communicate with you. And that's going to be an easier relationship to navigate.
I want to highlight just one other tool, because I know there's several people on this webinar from palliative care programs, and I think that they can be very useful programs. I know in Massachusetts we have a very strong program, and it's palliative care, not in the sense that imminent death, but any child with a chronic condition has a limited lifespan, and therefore they qualify for palliative care programs. And the important thing about the palliative care programs is that they often have a strong care coordination component. And while we wish that pediatric offices have strong care coordination components, not all of them do right now. So if you can figure out what programs in your area have resources dedicated to care coordination. Another one in my area that is very strong in care coordination is actually early intervention. So I know that those families involved with early intervention or palliative care have care coordinators that help the families bring these resources together and then help them connect and get those resources of communication, help them build the binder. It takes a lot of energy and wherewithal to create that binder that Karen was talking about. And I think if we have staff in our programs that can help families do that, that can be really helpful.
I think that's where the school nurse, if you have the luxury of having a school nurse in your school building or within your district, they can be that advocate and that bridge between that healthcare world, the education world. And if we talked about asthma a little bit, but if you have a child that maybe has a bee sting allergy or a different type of health condition that maybe you would not receive something directly from a pediatrician, if the school nurse is writing up an emergency healthcare plan, I would advocate for that school nurse to give 2 or 3 copies to the parents and say, this is what we're using at school. Feel free to share it with whoever you want. Back to the privacy part of it, I can share with a parent as a school nurse any of the plans that we have provided. What that parent does with that, if they want to share it with their church or their soccer team or whatever else, they can feel free to do that too. So that is just kind of a little bit of a workaround where the nurse can just hand off that stuff to the parent, and then the parent can give to whoever they'd like to share that with.
That's a great tip. Thank you. Well, we've got just about 2 minutes left for our panel time before we move into the Q&A. So I'd love to just ask each of you briefly, is there something that you would recommend as a next step or a tip or an idea specifically for our out of school time folks that are on the call today? Or for school nurses, actually, I should say.
I will just reiterate the part about understanding the impact you can have if you take the steps to understand the child's chronic condition. It really can make a lot of impact, I think, to show that you understand where they're coming from with their health challenges, and as best as you can gain knowledge in that and help them with that. I think it goes a long way.
Thank you.
And I want to bring us back to some of those frameworks where the school community, the family, and the student are the very center. And of course, the parents are definitely the experts in their own child. And so just having that listening ear for our school nurses to be able to listen well to parents, and then also communicate well between the parents and the pediatrician or whoever you're working with in out of school time as well. Making sure that we're looking again at, we want the best for our students, and that's where our focus should be.
Rose, any last thoughts?
Yeah, speaking to those OST providers and admin, I think the next step for them is just to engage in some self-reflection and see what your facility currently implements, what are your areas of strengths, and what are your areas where you could grow after, listening to the great material today. Taking that forward and making sure that you're providing the highest quality, equitable care you can for the children.